For most of us, pain, especially chronic pain, is very scary, actually. But there is a lot you can actually do to help that pain go away.
Right, joining us to talk about the latest ways to kind of control chronic pain is Good Day LA's medical editor, Dr. Tom Linden. Good morning, Dr. Tom.
Good morning, Susan Tony.
Got a whole group there with you.
We've got a whole group of people. You know, pain literally can change our lives. Uncontrolled pain can destroy our work lives. It can wreck our relationships. It even can make us suicidal. But most types of pain can be controlled. Tragically, though, not all patients and not all doctors know that. Joining us today to talk about pain management is Dr. Joshua Prager of the UCLA Pain Medicine Center, and one of his patients, Shirley Schneider. Thank you both for joining me today. Shirley, I'm going to start with you. I understand that you have had chronic pain for several years, almost a decade, 8 operations on your back. What was the pain like when it was really bad for you?
There were days when you don't even get out of bed. You can't. You have no choice. The only place you're comfortable is laying down. You can't sit. You can't walk. You can't stand.
Did it cause those emotional changes in you that I just talked about? Make you depressed? Make you not want to go to work?
Very. It's very hard to lead a normal life. There is no normalcy in your life.
And when was the pain worse? Was this just a couple years ago that the pain was really intense?
About 2 years ago, after about 6 of the surgeries. It just, I got to a point where I have so much scar tissue that it was just pinching the sacral nerve. And there's nothing, no amount of pain medication seemed to take care of it.
And the sacral nerve is a nerve that comes from your lower spine and goes down your
goes down the left leg.
And so you had pain that just shot down your leg, I understand.
Excruciating pain.
And now I understand the pain has been relieved. And let's talk with Dr. Prager now a little bit about what is the story for people who have chronic pain. Why do doctors not treat the pain that drives some people literally crazy, Dr. Prager?
Well, there are many reasons that doctors don't treat the pain. Part of the reason doctors are actually afraid to prescribe triplicate medications if they're necessary.
Now, triplicate medication is the ability to prescribe narcotics for patients. There are also several myths that both patients and doctors may believe in. Let's go over those myths one at a time, and you can just tell us very briefly what it's all about. Now, the first myth is I can only take medicine when I have pain. What's wrong with that idea?
Well, pain medicine shouldn't be taken on a time contingency basis. In other words, if a patient has pain, you don't wait for the pain to become severe before you take the medication.
Okay, the number two myth, I will become hooked on pain medicine.
Well, that's one of the biggest myths. There's a very big difference between addiction and tolerance, and some patients need pain medicine just as a diabetic would need insulin.
Okay, number 3, if I take too much medicine, it will stop working, the third myth.
As you take medicine, you will have to take more over time, but you always can achieve a level of pain control.
Okay, and the last myth, if I complain too much, I'm not a good patient.
That's probably the furthest from the truth. A doctor should always ask the patient, and the patient has to be honest about what the pain situation is to have it treated properly.
Okay, now let's look at this almost magical device that you brought here. It's a silver round disc, and it's an amazing device. It got rid of Shirley's pain. What's in that disc, and how does it work?
Well, this is actually a...
Why don't we just leave it right there, and you can talk about it.
Okay, this is a quite sophisticated computer. It has a reservoir that holds 18 cc's, which is basically 2/3 of a shot glass. And there's a computer in it that I can talk to from another computer that programs a pump to deliver minute amounts of medications.
And that medication is morphine.
Yeah, in this case it's morphine, yes.
And morphine that will completely make the pain go away, and it worked.
It works.
Works completely. Now, if any of you who are watching have questions about pain, we have a phone number that you can call, and that number is 1-800-4-CANCER. You can see it right there on the screen, 1-800-422-6237. It says 4-CANCER because it's from the National Cancer Institute, and a lot of the patients who have the worst pain that doesn't go away are cancer patients. But if you have any kind of pain, call that number, ask for the pain pamphlet, and they'll send it to you free.
Actually, could I just make a correction on that? That number is for cancer pain.
For cancer pain.
Right.
But a lot of the hints on cancer pain that I read about, I read the pamphlet, do apply to all types of pain, but it is specifically for cancer pain. Well, back to you, Susan and Tony.
Okay,
all right,
thanks very much, Dr. Tom. It's 8 o'clock, and coming up in the next hour of Good Day LA, we are going to jam with jazz great Stanley Jordan.
That is